Hello, welcome to Animal Chiropractic. If this is your first time using Animal Chiropractic, welcome. If you are returning, welcome back. My name is Dr. Paul Kiatswin Paez. I have 20 years as a national board certified doctor of chiropractic. I have a chiropractic physician license through the state of Oregon and 13 years as a certified animal chiropractor through the American Veterinary Chiropractic Association. Some people ask me what's my style or technique. I like to incorporate all the things that I learned through my 20 years as a healthcare practitioner, as a massage therapist, a posture neurologist, a chiropractor, and incorporating my own personal earth mind philosophy. The result of that is a gentle, intuitive, respectful approach to bring vitality, energy, and greater quality of life to your pet. My philosophy in healthcare is that your dog or cat is by design created to be healthy, and that occurs through the innate intelligence of their body. They are born with a system that is meant to keep them alive and doing its very best to stay balanced. And one way that we see that process happening is through the spinal cord. It's the conduit for the energy that flows from the brain to the body. It's a communication that is protected by the spinal bones. So, as an animal chiropractor, what I'm looking to do is to realign these spinal bones. And by restoring the alignment, we're improving the nerve flow, which then improves the function of organs, glands, muscles, and tissues. This means improvement in overall health. So, what is it that I'm looking for when I'm analyzing a dog or a cat on their visit? I'm looking for an impinged nerve. I'm looking for diminished nerve flow energy. And that's all happening through a fixation. There's a loss of motion between two bones of the spine, or what is referred to as a vertebra. So in this diagram here, the two blue structures are representations of bones, and the big broad yellow line is the spinal cord. The spinal cord has a nerve root, a branch that comes off of it that's called the spinal nerve. That spinal nerve actually has three nerves within it associated with sensation, function of organs, and muscle. So when that nerve is pinched because of the fixation, it can cause things like pain, numbness and tingling, organ dysfunction, muscle weakness. So we see that when these bones move together, it'll put pressure on that nerve. And that's what I'm looking for. I'm looking for the lack of motion of those spinal bones. The Merrick chart here helps to break down each of these segments of the spine, and it shows us the connection, the neurological connection between the spinal segments and the organs, glands, and muscles and tissues that they go to. So when we're looking at your pet, what we're looking at is the sections and the nerves that they go to. They can range from the neck, which would be from C1 to C7, the thoracic, which is anywhere where there's a rib, that's considered the thoracic section, so T1 to T13, and then anything after the ribs is going to be L1 to L6, including the SI joints and the tail. The dermatome is a way of showing how the skin actually has nerves that go to it, and we can map that out. So for example, if you look at C6, C6 represents the area of the skin that goes over the shoulder and down the front of the leg. There's a nerve that comes out between the C5 and C6, the C6 nerve itself, that goes to that portion of the skin. This becomes relevant when we're looking at things like hot spots or areas of heat or areas of sensitivity. So here are some examples of how the nerves coming out of the spine affect different conditions. So this is Fiona. This is my kitty who came in one day with a head tilt. This is really common, a head tilt with vertigo. In her case, it took several visits to be able to correct the head tilt. In most cases where we see vertigo, you're going to see visits up to about 24. It is a very complicated case, and it does take time to correct it. And the longer that animal has had the problem, the harder it is to correct. With Mimi, I had been seeing Mimi for some time, but she started developing megaesophagus, which is essentially the loss of the muscle tone of the esophagus. And so she was having food coming back up. She would be vomiting, coughing up food, and they would make the appropriate corrections of putting the food up higher so that she would eat and it would have time to digest. But once we started focusing in on these areas of C5 to C7, it only took about 8 visits, and she went from having the diagnosis of megaesophagus to being totally clear of it. Bubba had issues with hot spots. He kept chewing his paws. And in this case, he was having spots on the front and the back. So C7T2 associated with the front of the extremities, the front extremities, and L3 through L6 is the rear extremities. And in his case, it took about 8 visits. The key with these hotspots, when we're using chiropractic along with it, is to make sure that as it's healing, because they're going to have a return of sensation, that you really monitor them and make sure that they're not chewing more, because as they feel more, they're going to want to chew on it more. So having them wear booties or using essential oils to keep them from chewing is really critical. Lucy came in with leaking at night, and in her case, we focused on the L2 to the L5 area, and it took about 10 visits. As we came towards the end of those visits, and she was stabilizing, I did recommend that she take a supplement that would help with recovery of the nerve. Titan was having rear end weakness, so this oftentimes presents with the appearance like they're kind of squatting in the back. It almost looks like they're going to sit down, or they might be dragging their paws. We focused on L3 to L6. It took about 6 visits. I believe in his case, this was a really good recovery because his mom brought him in as soon as she started to see this weakness. And I believe that's what helped get that really quick recovery rate. So what is it that you can expect after your first visit? So your pet may be a little sore the first day or two. It's very normal. If they seem like quote unquote a little more lame, or they might sleep an entire day, don't worry. That's very common, and typically by the 4th or 5th day is when you're going to see all of that go away, and in fact, you'll see an increase of energy and a reduction of their major complaint. In some cases, there's no soreness, and they just go right into looking so much better. But typically by the 6th or 7th day is when we start getting some regression, so returning of those symptoms. And the reason for that is because there is that fixation, there is also scar tissue around the joint, and as we make the adjustment, it breaks up the scar tissue, it increases mobility, but it does take time for the body to accept that new position, and so the vertebra will go back out again. And so that's oftentimes why we have regression. The other cases will be that if it had been there for a long time, it's very severe. The nerve may have been impinged for so long that even as we free up the motion of the spine, that nerve still needs time to recover and heal. So please make sure that you keep everything the same. Continue the same walking regimen. Don't change anything. I do want you to pay close attention to anything that's changing or not changing during these days that I described above here, because we're going to review that on the second visit. And it's going to be really helpful for me to know how they're doing and give us an idea of how quickly we can expect that they're going to recover. I will reanalyze their spine, make the appropriate adjustments, and then we'll go through some stretches and special instructions. So if you have any friends or family that have pets that you think might benefit from what we do, please feel free to give them my information, and I'm glad to offer them a free 15-minute consult to see if what they have going on with their pet could make them a good candidate for chiropractic. This is my direct number that you can use, and you can also pass that on to your friends or family, and my personal website, animalchiropractor.org. Thank you so much for your time, and I look forward to seeing you soon.